Well, we start the morning with very good news. The good news is that GlaxoSmithKline's share price is £17.22. When Martin and I started to discuss this conference, the share price was £13. Now, the good news is that the PE has changed remarkably. So GlaxoSmithKline's forward PE is a multiple of 20 this morning. That means that for the world of investing, the area of healthcare is looking in better shape. I remember one stage in my career, I was commercial director of the Wellcome Foundation. We had a PE of 52. We just launched Retrovir, AZT. And a PE of 52 takes some reckoning with because your paper is worth a great deal. To see the decline over the last 15 years associated with the loss of productivity of typical big pharma and small molecules, and to an extent proteins, has been one of the disappointments in terms of funding our industry. To see the PE rebuild and to see the world of investing seeking out good quality assets worldwide is great news, and to see GSK and others start to improve their productivity in the traditional areas of small molecules and proteins is exciting. But that's not half as exciting as the converging world of medtech, which I'm sure can actually do extraordinary things, both for the quality of care and quality of health, but also for making healthcare more affordable for the world's economies. So I'm going to start by saying, for those of you who are seeking venture capital, and we can ask the venture capitalists later this morning, I think the PE change is one of the vital factors that we need to see the energy, the skills that we have released to meet unmet clinical need. Now we're here in part because of the policy that GSK followed under Andrew Whitty, which was open innovation, a policy of 40 in-house projects and 40 out-house projects. I chair the Wellcome Trust. The board of the Wellcome Trust came down to hear about the R&D and GSK, and we were very excited by the way in which GSK has organised its R&D, not in great silos, but in discrete, accountable units that are allocated funds on a 3-year basis and then have to perform. When GSK came to Wellcome and said, we'd like to look at a biocatalyst, we want to drive Stevenage to open innovation, we said we'd be delighted, and along with the British government, we put up the 2 buildings that you came past, the best looking buildings on the site, which also give you access to here, to the gym, and one hopes to the intellectual capabilities of what is one of the great previously inbred clusters in the United Kingdom. Now we're hoping to increasingly outbreed it. So I would start by saying we've got good news. We have an increased multiplier. We're seeing a fashion of open innovation actually getting to the pharmaceutical majors in the world, who are increasingly looking for great biology and great research ideas coming out of universities as being the key to drive their developmental and distribution machines. We have the chance at this cluster, we have 20 acres we can build over, so we have the chance of bringing a great deal of new skills, different skills to feed off the cluster of Stevenage. But it isn't just Stevenage we're looking at. The whole thrust of the partnerships across the various catalytic centres, and it is partnership with Oxford, with Cambridge, with Edinburgh, is to try and create an increased expectation in society that R&D academics work with industry, that investors find their way into the secrets of academia more easily. And we also explain to the NHS that whilst the UK only may represent 1% of the global market in 20 years' time, nevertheless, if they really get their act together and help us with both clinical trials and with purchasing and early registration, then they can help the great talents we have in this nation of ours. So we're proudly jingoistic about being in the United Kingdom. I certainly feel that the skill base we have in the UK should have the opportunity of making us one of the great clusters in 30 years' time. I mean, I've worked in San Francisco, San Diego, and Boston. For various reasons, I think that although the climate may be better in San Diego at some times of the year, at the end of the day, I know I'm a Brit, but I find London very agreeable. So if I can create wealth in London, that's where I try and do it. I find San Francisco and San Diego doesn't quite fit my characteristics at the end of the day. So what are we here to achieve? We're here to achieve a real focus across academia, industry, entrepreneurs, venture capital, and the NHS, that we need to work together to realize the great skills base that exists in the United Kingdom. And creating that expectation and driving a culture change to achieve that has to be, it's a long-term task, but we need to make sure that people understand that it's only by a hypothesis of trust in the first instance, as against at times an arrogance of disrespect, that we're going to succeed. So by bringing the disparate groups here today and creating those environments whenever we can, one hopes that we're going to find routes for new partnerships to be created, new trust to be created, and take that great research source we have through to the marketplace. Secondly, it's great to have a convergent technology discussion. I sat down the other day with a man making satellites and a man making Aston Martins, and we had a wonderful discussion about how they could combine their joint skills to focus on the human. They never thought of it before. About a week ago, I sat down with the chief executive of ARM, and he told me how he could now build a microprocessor thinner than your single hair that had more power than the initial computers on the initial moon landing. And he didn't need batteries because he needed so little power, he could work off the heat of the body. And his determination the next 10 days was 10 years, not 10 days. I'm getting old, so 10 days is long enough now. His determination was to make that a reality, and I think that's a fascinating determination. So we're here to talk about medtech, not just about small molecules, not just about proteins, but really get into medtech, embracing obviously the former, and it's great to see more products coming through the FDA, and the cycle of despair and lack of innovation, one hopes is changing. Thirdly, we're here, and I've mentioned it already, to create partnerships. So we have investors here, we have research scientists, we have entrepreneurs, we have some commissioning groups here, and we have CROs here. And so creating those partnerships that rarely exist. Wellcome invests quite a lot of money with the MRC in the biobank, and I was talking from someone from the biobank the other day and said, have you met the leading CRO, the chairman of the leading CRO in the world? Have you met him? No, they said. Well, I said, I think you should, because it's about time we unlocked the magic of biobank and started to look at the relationships between the phenotype and, now it's getting affordable, the genotype, and we should work with the CROs to see what they think the market could reveal for us. So they're the partnerships that we need to create. Please come out of your comfort zone. It's nice to go and greet colleagues. Go and greet other people who you've never met before. Find out what they're doing and seeing if what they do is in any way relevant. Lastly, Stevenage. We've got to see Stevenage successful, and I think it will be successful. And what I hear from Martino is that there are a number of great new partnerships coming on, which will create a diversity of interests and skills, which will not only enrich the dining room of GSK, but will enrich the suite of innovation we can deliver.